Breast surgeon Ian Paterson is facing a police investigation and suspension from practising after allegations that he performed unnecessary and invasive procedures in over 1,000 breast cancer patients dating back to 1994. He is accused of operating on at least 450 women when they were perfectly healthy and performing partial mastectomies on 700 women using a risky technique that doesn't remove all the cancerous tissue, thereby greatly increasing the risk of secondary cancer developing. While he was working for NHS and private hospitals run by the Heart of England NHS Foundation Trust, which covers hospitals in Sutton Coldfield, Solihull and Birmingham. Mrs. Boichat was treated by Paterson for breast cancer, and she describes here her aggressive treatment, the radical mastectomy operation she underwent, how she was treated with the powerful cancer drug Tamoxifen, which brought on an early menopause, and describes the moment she heard she didn't even have the disease.
It happened in 1995. I found a lump, went to my GP, told me he wasn't concerned but would need to send me to a surgeon. Went to see Ian Paterson, had a mammogram, ultrasound, needle biopsy. Went home, got a call from the breast care nurse, said, think we need to have a chat. Got called back in by her, and she actually told me, you've got breast cancer. We went home and then we must have had another call to go and see Mr. Paterson. And he said, well, you are only small and you're only small busted, so you know, there's no choices, you'll have to have a mastectomy. In February this year, I had a letter from the trust saying we're recalling Mr. Paterson's patients. So I went for the recall. Dr. Webster examined me. He said, take a seat. So I did, and he said, yes, he's left the cleavage sparing, he's done a cleavage sparing mastectomy. He said, but worse than that, girl, I have to tell you, I've looked in your notes, because I don't normally do that, and you've never had cancer. In my eyes, he is a criminal. I can't help but feel he is a criminal.
Mrs. Boichat was one of the many women who had an operation known as the cleavage-sparing mastectomy, whereby some breast tissue is left behind for cosmetic reasons. But it's not sanctioned in Britain, as there is a strong risk of the cancer returning. Women operated on now by the surgeon are suffering secondary and in some cases terminal cancer as a result of this procedure. It's not clear what prompted the surgeon to allegedly perform these unnecessary surgeries, but Paterson, who is being represented by the Medical Defence Union, has said, I'm cooperating fully with the GMC investigation and cannot comment on any of the issues raised because of my duty of care to patient confidentiality and the ongoing investigations. Now, figures show that 50,000 new cases of breast cancer are detected every year, and breast cancer is the second biggest cause of death after lung cancer for women in the UK. So questions will be asked why Paterson was not investigated earlier when evidence came to light back in 1994, and how so very many women received such shocking treatment both in the private and NHS sector. I'm Anne Salter, thanks for watching. Stay tuned for the very latest health news and updates with me at ibtimes.co.uk.